I'm Haley Harman, and this is my complete head-to-toe physical assessment. So I would walk into the exam room, provide privacy, perform hand hygiene, introduce myself, ask the patient her name, say your name.
Oh, Lexi.
Ask her what the date is.
The 9th.
Okay.
March.
And do you know where you are?
My house.
Okay. And do you know why you're here?
An assessment.
Okay. So there I've assessed that she is alert and oriented. She knows where she is. I'm also visualizing her as a whole, looking at her personal hygiene, observing her speech as she's talking to me, and watching for any deviations from normal in speech, coordination, anything like that as I'm doing the entire assessment. Same with her skin. As I go through my assessment, I'll be assessing her skin as I go. So from what I can tell, her skin is normal. Her face is symmetrical. Looking at her nails are normal, there are no ridges, they're smooth. I'm looking at her posture as she's sitting there. She has good posture, she's not slouching, she doesn't appear to have any sort of spinal issues at this point. I'm also looking at her nutrition. She doesn't look to be malnourished or overnourished. She's a young, athletic build. And also as I'm doing my assessment, she's making eye contact with me as I ask her the questions. So now I'm going to start at the head. I'm going to look at the scalp. I'm going to palpate, see if I can feel any areas that would be raised or any areas that are dipped, and hers is completely symmetrical. I'm also looking at her hair as I go through. And then I'm looking down at the face. I'm going to go ahead and assess her temporal artery, feeling a pulse. I can feel the pulse. And going to her temporal mandibular joint. Can you open your mouth and close it? Okay. There are no clicks or there's no tenderness there, right, when you open your mouth? Mm-hmm. Okay. So, and from there, I'm going to palpate her sinuses. Let me know if any of this is tender. So none of it appears to be tender. Now I'm going to move on to the eyes. What I'm going to have you do, we're going to do the confrontation test. So put your left hand over your eye. Okay? I'm going to put mine, and you tell me when you see my finger.
I can see it.
Okay. Keep a solid glaze at me.
Oh.
Okay, and now with the other eye. Tell me when you can see my finger.
You can see it.
Okay. And so that is normal. Now I'm going to be assessing her eyes with a light, testing her corneal reflexes, and also testing if they're equal, round, reacting to light. Now I'm going to do the 6 cardinal points for gaze. So I'm going to have you look up, over, okay, she's able to move, both eyes are symmetrical. Now I'm going to assess her ears. Her ears also seem to be symmetrical. They're both same on her head. So I'm going to be looking into the ear ears to assess her eardrum. Okay, they are a nice pearl gray. Doesn't appear to be any inflammation or redness in the other. Same with this gray pearl with no signs of irritation. Now I'm going to do the whisper test. I'm going to say 3 words, and I'm going to have my hand over my mouth, and you have to repeat those words, okay?
Dog, house, bird.
Okay, that's correct. So now I'm going to be looking on her nose to make sure that there are no lesions, and make sure that her septum is symmetrical. Okay, it appears to be symmetrical, and there doesn't appear to be any lesions or anything like that. So now I'm going to look in her mouth, and I'm going to grade her tonsils. I would say that they are a 2+. I'm looking at her palate, her teeth, her gums. I would have gloves on as I'm assessing anything that would deal with bodily fluids such as saliva. So there doesn't appear to be anything out of the ordinary in her mouth, no lesions, there are no bleeding, anything like that. Now I'm going to ask you to say ah. Okay, and now stick out your tongue. Okay, everything appears to be symmetrical. It appears she also has a gag. Testing that with the ah. Now I'm going to move on to the neck. First, I'm just going to assess the neck. There doesn't seem to be any jugular distension. Now I'm going to palpate. I'm going to stand behind her. Okay. There doesn't appear to be any masses. There's no tenderness. There's no tenderness, correct?
No.
Okay. And her trachea is midline. Now I want you to move your head around so we can test the range of motion of your neck. Okay? Appears that she has full range of motion. Now we're moving on to the chest. Again, just observing. Just start with seeing that she is symmetrical. There doesn't appear to be asymmetrical. Now I'm going to test the symmetry of her shoulders. Okay, can you raise your arm? Raise your shoulders. Okay. And so that seems to be symmetrical. In hers, her clavicle, you can see it, and so that would also be a way to see if it is symmetrical. Now I'm going to assess the lungs as well as the heart. I'm going to do the lungs first. So I'm going to be listening to the breath sounds and then go into percussion. Now moving to posterior. Okay. Her lungs are clear. There doesn't seem to be any adventitious sounds. So now I'm going to percuss. same with the back. Noting that any dullness could be because I am on top of a bone. Okay. Now I'm going to do the whisper soliloquy. So I'm going to have her whisper. Just choose any 3 words and whisper. And again. Okay, and they are barely audible, and that is a normal finding. So now I'm going to have you do bronchoscopy and agophony. I want you to say E, E, and again, E, 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 okay? And now say 99.
99, 99, 99, 99.
Okay. And now moving on to the heart. I'm going to listen to all 4 valves, the aortic, mitral, tricuspid, and pulmonic. Okay, and while I'm here, I'm going to count her apical pulse. And I'm going to count this for a full minute. And I got 61. So now I'm going to move to the upper extremities. Going to assess your pulses to start with, your radial pulses, making sure that they are palpable and symmetrical. And they are not bounding or thready. I'm going to test the strength of your hands. Can you squeeze my hands? Okay, very good. And now can you roll your wrist, testing the range of motion. And now can you raise your arms straight up, all the way? Arms back, okay, and then down and around if you can. Okay, and then same with the elbows, testing the range of motion of all of her joints in the upper extremities. So now moving on to the abdomen. To start out with, I'm going to look and see if it is symmetrical. And I might have to have you lay down for this one, just so that I can get a clear read. Yeah. Yeah, that's fine. Okay. So now I'm looking to see she is symmetrical, and it's flat. It doesn't have, it's not concave or anything, although you can see her ribs. First, I'm going to assess her bowel sounds before I touch, because it can produce bowel sounds when I start messing with her abdomen. So I'm going to listen in all 4 quadrants. Okay, and they are active in all quadrants. And also, another thing to listen to is for the pulse. And I could hear hers the whole time I was listening to her vowel sounds, and I can also feel it as well as see it when I am listening. I do not hear Brewy though, so now I'm going to palpate for tenderness. There's not any tenderness. Okay, so now making sure that there is privacy. Is it okay if I lift up your shirt and expose your stomach? So I'm observing and assessing her her belly button, and it is inverted, and it is in the center of her abdomen, which is what we would expect. Now I'm going to palpate the liver and the spleen. Okay. Okay. And also perform the scratch test to find the borders of the liver. And the sound is amplified with the stethoscope. So with that, you can find the borders of the liver. Okay, we can go ahead and stand up, and you can sit back in the chair. Okay, so now I'm going to assess the lower limbs. Obviously, I could observe her range of motion as she was standing up, which is not something that would probably do with an actual patient, but in this scenario, I saw that she has full range of motion of her knees, hips, and I will assess her ankles. Can you roll your ankles for me? Okay. Now I'm going to assess the pulses. I'm going to start with pedal. Okay, and those are positive. And the popliteal. And a post-tibial. Okay, and all 3 are positive. And as I assess the range of motion, I can also assess the joints. I see that her joints, they have no problem functioning. There isn't any swelling in any of the joints that is visible, or in the ankles. She has pants on, but I could assess the skin, and would assess the skin, any hair, anything like that on the lower extremities. Look for varicose veins, things like that. Can I have you stand up? I'm going to assess her spine. Looking for kyphosis or scoliosis. Can you bend over, please? Just so you can get a more definite feel on the spine, and hers is straight and it can be stand up. And there doesn't appear to be any kyphosis or lordosis either. So you can set that down. Now I'm going to assess her neurologically. And I have been doing that the whole time. She's been following all of my commands. She is coordinated. And now I'm going to assess the Babinski using a tool of choice for that. So with this, I'm looking to see if she fans or if she curls. Okay. A positive Babinski would be one that the toes fan. Now I'm going to ask you, hold your hands out and take each pointer finger and touch your nose. Okay? And then do the heel to shin. Take it and run your heel down each shin.
Want me to stand up?
No, you don't have to. You can do it down. Let me say again. Okay. Okay. Now I'm going to test your sensation. Can you close your eyes for me? You feel?
Yeah. Mm-hmm. Yeah.
Just testing the sensation of her feet and legs, hands, face. Now I'm going to do deep tendon reflexes. And you would use a hammer, but I don't have one, so I'm going to be using the end of my stethoscope. So I'm going to test the brachioradialis. Okay. Her fingers moved, so that shows. Okay. And then it's important that she be and relaxed with her feet dangling for the patellar. Okay. For the tendons, you don't want them to have an overreaction to the reflex as well. So now with the Achilles, feeling for movement, just keep your leg relaxed. Okay. Okay. And that is it for my head to toe physical assessment. I would ask if she had any questions for me in regards to anything that I performed, and answer any questions as I see appropriate. But do you have any questions?
No.
Okay, that is the end of our physical assessment.